Hello, and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we're going to talk about a subject that is on everybody's minds right now, and that is the new coronavirus that is spreading. My guest is Nancy Lemis. She's a nurse and the epidemiologist for the health department. Welcome.
Thank you. Thank you.
I don't even know where to start. It's like, you know, it's kind of escalated to almost panic levels out there, and it probably shouldn't. We're more in prepare than panic, right?
At this point, yes, we still are in preparation. We're trying to be prepared. Hopefully we're preparing and it's not going to come to fruition, but we just don't know that. So you want to be prepared. You want to get educated. You want to get informed, know what we're dealing with and what changes day to day. So you want to make sure that you're going to reputable places to get your information and not just from Facebook or just the news media. You want to make sure you're listening to the experts. So
and along those lines, you can go directly to those sites, but we also are building out a page, hampton.gov/coronavirus, with links to those reputable sources. The
Yes.
Centers for Disease Control,
the Virginia Department
of Health, other places where I think ReadyGov lists some preparations that you can make. And it's a little bit like preparing for a hurricane. Might not come,
Right.
but,
Just be prepared.
Have food on hand to last
And your
about 14
medicines.
days, and your medicines, and kind of cold and pain relief medicines.
Right.
Tissues.
Yes.
So that you don't have to go out if,
Right.
it hits.
Now, coronavirus it's been around for years and years and years. There are 7 different types of coronavirus. 4 of them are really associated with very mild illness. The common cold is a coronavirus. We have had 2 in the past that have caused severe illness, and that was SARS and MERS. And one of the SARS is, both of those originated across the world on the other side. We did have some issues here, but it was from travelers. Now, this one is considered a novel coronavirus. It is a new coronavirus that's mutated from a virus. Now, most of our coronaviruses infect either animals or humans, and then it can spread human to human, and that's what's happened. It's spread through droplet. You can get it, somebody sneezes, coughs, and you get those germs in your nose or mouth, and that's how you become ill.
So this is a new term for me. They're calling it social distancing.
Yes.
Which means kind of don't rub shoulders with people.
Try to stay,
if there's an infection.
Try to stay 6 feet away that is a good point. And with healthcare providers, they're recommending that, if you're going to take care of somebody who is ill, whether it be coronavirus or a respiratory virus, you want to make sure that you do keep that distancing as much as possible. And then they wear their PPE, their personal protective, where they're wearing masks. But for just the general public, you do want to do that. If you're sick, try to stay home. If you're coughing, sneezing, try to do it in a tissue. If you do not have a tissue, then use your elbow. But please wash your hands after using a tissue or coughing in your hands or sneezing. And one of the big ones that a lot of people don't realize, and if you watch people, you go in a situation, you're sitting at a table, you watch people how many times they touch their face and their eyes. That is a way you can spread germs. So you want to make sure that you keep your hands away from your face and just constantly wash your hands.
So the germs can also live on surfaces, right?
It can, if people sneeze or cough, it could be there. So you want to wipe down common surfaces. And when you're cleaning things, always look on your cleaning products on the back of them, because it tells you what's called the kill time, how long that product needs to stay on something to kill those germs. Because you hear the commercials, 99.9%, well, you have to follow their directions to a T, because that's in a laboratory. So if it says it needs to stay on the surface 2 minutes before you wipe it off, then you need to leave it there 2 minutes. So,
and speaking of following directions, when you say wash your hands, many of us don't wash our hands for the recommended length
20
of
seconds.
time.
20 seconds. And if you do not have soap and water, if you're not where there's a sink, if you're in your car going through a drive-through, anything like that, always have the alcohol-based hand sanitizer with you. And then when you get to a place that has soap and water, then wash your hands.
So what do we need to be doing now?
Right now, you need to be just keeping informed. Make sure you're keeping informed, listening to the experts, finding out what they're recommending. If you get sick, you need to consult with your healthcare provider. We are asking the people who have traveled, if they do get sick, call ahead, let them know they're coming, and then put a mask on when they get there, so that other people that are in the emergency room or in the urgent care or the doctor's office aren't exposed. So you want to just make sure if you're sick, stay home.
Because let's also talk about this. Most of the people, the vast majority of the people who get the virus, it doesn't escalate into something serious.
Right.
It's equivalent to, in some cases, just a cold.
Right.
In some cases, maybe aches and a little bit of chill, like the mild flu.
Right. You have a fever, you can have a cough, aches, body aches, sore throat, those kind of things. For most people who are normal, healthy people, it's just going to be very mild. But people who have other diseases, diabetes, heart disease, maybe somebody's on chemotherapy, or have some kind of chronic illness, they're more apt to have more severe infections. The infections, when you're talking about a respiratory, are usually pneumonia, lung infections of some kind. Now, if you start running a fever, you have a respiratory symptoms, runny nose, cold symptoms, then you need to consult your doctor, because it may not be coronavirus, it may be regular influenza.
Right, we're in the midst of flu season as
and
well.
it is still not too late to get your flu shot. It's very, very important, because we lose more Americans every year to regular influenza than we do most other things. So you want to make sure you take that one precaution and get your flu shot. And the flu shot is not a live vaccine. You're not going to get sick from the flu shot itself. Yes, your arm may be a little sore. You may feel a little just a little fatigued. You may have redness at the site, just because your body has to make those antibodies to protect you. So,
yes. And that's what you wanted.
Right. It's not going to give you the flu. And that's, so many people think that it makes me sick. It's going to, but still, you need to protect yourself.
So, speaking of vaccines, there is none for the new coronavirus. People are working on it.
Yes, they are.
But it will take a long time.
It can. It can take a while, because they have to get the right, I guess you would call it, the right vaccine or the right things in the vaccine to protect us.
And they have to test it.
And they have to test it.
Revise it, probably.
Right. Yes, yes. And with regular flu, every single year the vaccine's different. So if the virus were to mutate or anything like that, then they would need something different. So they have to really do a lot of studying before they just put a vaccine out there.
Now, if it becomes widespread in Virginia, in Hampton, in the region, whatever, how is the health department working with local governments, especially Hampton, to make those preparations?
Yes, we are working with all of our city agencies, our fire, police, the jails, the hospitals, all of our medical providers. We're sending out regular information to them. On our website, our commissioner, he puts out a letter every week, and you can read that on there. There's information about if anything changes with the virus, which it has since it started. Recommendations have changed, some of their recommendations, as well as some of the suggestions that they're having for facilities, especially long-term care, nursing homes, where people are fragile.
Yeah.
So we're working with all of them to make sure they have their plans in place. If for some reason there's a shortage of masks or things like that, there are suggestions on there of things to do, especially for healthcare workers and for the public. They're telling you don't walk around with the mask. It's not going to help you. Just do that social distancing. Because if you're keeping a mask on all the time, it's getting wet from where you're breathing, and then you can get other kinds of infections. So you want to make sure that you just follow the current guidelines and try not to panic, because you can protect yourself. You can just wash your hands, stay away from sick people, and just use your common sense and do what you should. They may limit some of the social gatherings and things, but we're just going to have to wait and see how things evolve.
But I will say there are plans in place if that has to happen. People do need to check with their employer and find out, can they work from home?
Right.
Schools have a plan to continue education if they have to close all or one or whatever needs to happen. We will get through this.
Right, we will. We will.
Do our best at keeping essential functions running and things like that.
And we meet, we have a Polycom once a week, every week, with all of our partners and they're meeting different Polycoms and different meetings with different groups. Some are the hospital associations, some of our colleges and universities. So all of these people are planning. We all had pandemic plans in place back when we had H1N1, but everybody is revamping them and making sure that everybody knows their job and what they're there to help, and that's what we're there for. We're doing surveillance on people who are ill. We're following people who have traveled. We're just making sure that we're trying to protect people as much as possible, and that's what we're here for.
Compare this to the flu. It's caused by a different virus, obviously. Right. But in terms of severity, symptoms, all those kinds of things, is there a difference?
Well, with influenza, a lot of us could get influenza. And if you get your vaccine, even if you get influenza, and you can even if you get your vaccine, because nothing's 100%, but that does help you from getting the severe illnesses. And as far as this goes, right now they're thinking that it is a little bit milder, except for the people who do have comorbidities or other diseases. Not to say that a normal, healthy person won't get it, but so far from looking at what we've seen with the people that have gotten ill, it has been more of the elderly or people who have other illnesses, and then they get infected with something else, which...
But that's kind of the same thing with the flu.
It is. Flu can be, normal healthy people can die from flu. So that's why it's very, very important to do what you can to protect yourself.
Okay, so I'm just going to recap. To protect yourself, number one is wash your hands.
Wash your hands.
For the full 20 seconds.
Yes, yes.
Use sanitizer if you don't have water and soap.
And alcohol-based.
Yes.
Yes.
Okay.
Cough in a tissue, then wash your hands. Wipe down common surfaces, doorknobs, handles, rails, things where people are touching, counters, computer tops, all of those things. Just keep them wiped down constantly. Toys, if children are little and putting them in their mouths, you can actually put a little bit of bleach in your water and let it air dry, and it's safe for children. That's a good way to clean the toys. And you should try the social distancing. Don't share drinks. Just be very, very careful. Use disposable tissues, not handkerchiefs. A lot of our older gentlemen still carry the handkerchiefs in their pockets.
My father-in-law does, absolutely.
So you want to use tissues and always put them in a trash can. If you could put them in a trash can with the lid, that's better, but always put them in a trash can. And those are
Stay informed.
Yes, stay very informed.
With reliable information.
Yes. And if you have questions, you can always call 1-877-VDH3. And we have people on the phone in Richmond that are answering questions. And if you have any other questions, you can always contact your local health department.
And I would say travel recommendations continue to change. People should watch the CDC for that.
Yes, and there's a section when you go to CDC or the Virginia Department of Health, they have links that are really easy to follow, and it tells you where there are restrictions for travel.
Or And people might want to make other decisions as well.
Yes.
So your own personal risk and how you calculate that might be different for individual folks.
And it may change day to day. So you want to just keep going back and looking, especially if you do have plans to travel, especially out of the country. Not so much in the United States, but out of the country. You want to look to see how many cases, and all of that is on the CDC website.
Because generally, here's the thing too, if you're traveling, you are going to see things. You are going to, museums or concerts or big gatherings. So you do want to know what's going on in that particular location.
And if we have here in the United States, if we have any recommendations that they want to limit social gatherings and things like that, that information is going to be put out there so that you can stay informed and protect yourself.
Do we have any indications whether this virus is going to slump in the summer as the cold or the
We do not know yet. We do not know. We're hoping it will with the warm weather. In the past with the 1918 flu, it did, but we don't want it to just lay dormant and then come back. So we're hoping that with the warm weather, yes, it will. But we see flu, a lot of people don't think they can get flu in the summer either, but you can. So we do see some flu in the summer and the spring. Most of the time it's the fall and the winter. But
hopefully,
hopefully.
We just don't know yet exactly.
We do not know.
That's why you call it the novel coronavirus.
Yes, that's why it's novel. It's very new,
and we're trying to figure it out.
And scientists are learning.
Have we learned things from other countries where this hit first?
Yes, all the scientists are working with the CDC. We have the World Health Organization, and they and the CDC work side by side, and are always passing on information. And as they developed the new testing with CDC, had to get the testing so that we could actually test for it because we didn't have a test for it. So we're having to develop things as we go.
And we in Virginia have test kits that can be processed here.
We have a division of consolidated lab in Richmond that can do some testing. All of that is done by your risk, depending on if you travel.
You can't just rush out and say, I want to be tested because I'm nervous.
Right. They have to meet the criteria as far as symptoms, illness, if they had any risk for traveling, where they've been, things like that. And there's other tests that they would do first to rule out other things before they tested for the coronavirus.
Probably the flu test.
And then they have a respiratory viral panel that they can do for other respiratory infections and things like that could maybe causing the same symptoms.
Right, so you can get that cleared up.
Right.
Not that it's not better to have the flu.
No, it isn't. You can still get very sick.
There are some treatments that can shorten or lessen.
When you have influenza, we can sometimes give antivirals, such as Tamiflu, and that helps your symptoms lessen a little bit. It doesn't. There's no cure for any viruses, so that's what we want to do if possible. And you want to go as soon as possible. Don't wait till you can hardly get out of bed. You want to go call your healthcare provider ahead of time.
Okay.
Yeah.
Is there anything you want to add that we haven't talked about?
Just wash your hands. And if you have any questions, don't feel bad about asking those because you need to be correctly informed. And don't just believe everything you see on Facebook.
And don't rush out and buy a mask and wear it in public because it's not really going to protect you. But if you are sick, coming into contact with people, a mask is a good idea at those times.
Right, when you're sitting in a waiting room at the healthcare, because you don't want to go in for a hurt finger and come out with something else. So you want to, again, use your common sense. That's your best thing for yourself to protect you.
I think when people get worried and get to a panic level, common sense goes out the window. So that's
don't
a nice
hoard don't hoard your hand sanitizer and don't
rush out.
Right, you don't need cases. You just need a couple of bottles that you can have strategically placed in your house. So if you're busy doing something, you don't forget to use it. But don't go out and get cases of tissues and cases. I don't think we're going to run out of all of that. So
okay. Well, thank you very
You're
much,
welcome.
Nancy.
You're welcome.
And thank you for watching. At the moment we're taping this, there are no cases in Virginia, but it is really important to stay informed. Go to the health department website, watch for updates, and calculate your own risk. Don't panic, but do prepare. Thanks for watching.